Welcome back to the Peer Perspective Podcast. I'm your host, Calvin Blaircom. I have another awesome episode for you today, but before we get started, if you or someone you know might benefit from hearing today's message, make sure you like, subscribe, and share the episode. Your support means the world. On today's episode, I had the honor and privilege to sit down with Bob Rohret, the director of HHS here in St. Croix County. I had the opportunity to get to know Bob a little bit over the last couple of years. And during those conversations, he had shared that he's in recovery himself. I was a little nervous about asking him to come on and share, but he said yes. And so I just think that it's pretty powerful when people open up and share some of the things that they've been through, and it helps to kind of normalize it and reduce the stigma. So I'm just really, really excited to share. Without further ado, here's Bob.
All right. I'll introduce myself. You ask me follow-up questions.
For sure.
So my name is Bob Rohret. I'm the Director of Health and Human Services here at St. Croix County. Been in this position a little over 5 years, about 5.5 years.
Okay. And you've been in the field for a long time.
I've been in the field for over 30.
Okay.
Yeah, in different parts of the country.
Okay.
Yeah, I started in Iowa, where I grew up, and I worked there for a number of years, and then moved to Hawaii. And
oh, that's right.
I lived there for about 3 years, and for reasons I can't explain, I moved back.
Yeah, no kidding, especially on a day like today.
Right. Yeah. And then I worked in Minnesota for, I guess, about 7 years, and then came here.
Okay. Mm-hmm. So maybe, I guess let's back up a little bit.
Yeah.
And you can kind of talk about, like you said, you grew up in Iowa. What was that like?
Well, I grew up in a very, very small town, rural area of Iowa, so it's not much different than here.
Okay.
Where we live now near Hammond is really similar in a lot of ways,
Yeah.
But my dad was a farmer, and we were close enough to a university town that I ended up gravitating towards that eventually.
Yeah.
But yeah, small town stuff,
Can you talk, so what was your experience? I mean, obviously you shared that you're in recovery yourself, but can you talk a little bit about when you realized that maybe that was problematic for you?
I think probably the people around me recognized that sooner than I did. I think there was a period of time, probably most of the time that I was drinking, where I was trying to think of ways to explain my problems outside of my alcohol use. So it was not so much that that I saw it as problematic. I saw it as something that could be changed by doing other things, by moving somewhere, moving to California or wherever I went, as a way to sort of change my circumstances, And it wasn't until really, I would say, the last 2 years, 3 years of my drinking where it was, you're aware that it's causing problems. But it was those last 2 or 3 years where I couldn't internally deny it. I couldn't, the problems were apparent, not just to everybody else, but to me. And I think, just to be maybe more specific, when it starts to interfere with literally every aspect of your life,
right.
when it's creating problems with your work or your ability to function. I mean, there's a point where you become aware of it, but even understanding that it's a problem sometimes doesn't mean you're
going to do anything.
You're
about
able
it.
to do something about it. It's the nature of the illness.
Yeah, for sure. I'm sure a lot of people can relate with that. I know I can. Yeah. So what was the turning point for you? When were you okay, I got to do something different?
Yeah, that didn't come until almost the end. I think for me it wasn't a matter of courage or insight from some sort of revelation. It was really a fear of dying, I think, that caused me to take any action. As it says, in the big book of Alcoholics Anonymous, and you're probably familiar with this, but there's a point where you can't, or where I couldn't imagine life without it. I couldn't imagine what that would be like.
Yeah.
And the not knowing that is scary in itself, right? Because you don't know what to expect. I didn't know how to live without it. So the fear of change was more around what would life be like if I didn't drink. I knew what it was like drinking, which was terrible, but it got to a point. So what caused me to change, what caused me to take action, I should say, was a combination of things. There were a couple of guys where I worked in California who were in recovery, and I think I was thinking I was being successful in deceiving others about my situation. I was either fooling them, or through my personality, I was avoiding any accountability for how I was living. But these two guys who were in recovery, obviously, they saw right through me. And when somebody points that out to you, and you think you're being fairly successful in deceiving everyone, when they point it out to you in subtle, sort of gentle ways, and let you know that they see you for what you are,
right?
That's eye-opening, right? I mean, it's a shock almost. It was to me, and so that got me thinking about it more. But I think it was really at the very end where my options became more narrow as my addiction progressed. So my choices became more almost binary, and it got down to the point where I was aware that if I didn't stop, I was going to die soon. And so the reason that I actually, after a couple of failed treatments, I shouldn't say failed, after a couple of treatment episodes where I didn't stay sober, I was to a point where I knew if I didn't, I would die. And that fear really was the thing that triggered my decision to throw up the white flag and say, I don't care what happens at this point. It can't be any worse than this. And I then allowed people to help me, But it wasn't until almost the end, and I was 25 years old when I entered recovery. So I was young,
How old are you now?
I'm 61 now.
Wow,
yeah.
That's awesome. Yeah. So you said you went to multiple treatments.
Yeah.
Okay. How many?
I went to 2 in California.
Okay.
And then I went to there was a detox, social detox in Escondido, California.
A social detox.
Yeah, it was.
Sounds very Californian.
It was a little rough. It was a little rough, but So I went through one treatment program, and there were kind of the standard 28-day things,
sure.
Which is completely an arbitrary amount of time. There's no science that shows 28 days is the magic bullet. But anyway, relapsed after each episode. I went to 2 treatment programs in California. One actually kicked me out because my insurance wasn't good. So they asked me to leave.
Yeah,
that's nice, huh?
Yeah.
So if you're, getting cancer treatment, I would hope they wouldn't say, well, you have to leave because they might, I don't know. But in any case, so I went to treatment a couple of times in California. I went to there was a detox center there, and then my family, when I did reach out for help, my family brought me back to Iowa. My oldest brother was the executive director of a nonprofit, and his wife, a social worker and a nurse. So they had an idea of like where I could go in Iowa, and I ended up being civilly committed to a state hospital, probably like Winnebago, something like that. It looked like something out of a Stephen King novel. This place.
Wow.
Which was kind of cool. It was an old, like the one that used to be in New Richmond. It was an old insane asylum kind of place. But they had a chemical dependency at the time. That's what it was called, chemical dependency ward. So that's where they committed me to. And I was more than willing to go, but the civil commitment helped expedite it a little bit. Yeah. So I went there for whatever it was, 28 days or roughly that. And When I got out, I lived with my brother. I got a job at a factory that made grease guns in Spencer, Iowa, and I made grease guns on an assembly line for about 5 months. Saved up some money and went back to California. Got my old job back. I had been fired for drinking. And so I started to rebuild my life gradually and clean up some of the mess in California. And that's when I got interested in going back to school. I had flunked out of college, by the way, a couple of times related to drinking. And I started going back to school in California.
Did you go for the same thing, or did you change?
I was completely without a compass in college before.
Yeah.
So I had no idea what I wanted to do. I was a junior in college and had no idea prior to getting sober. So when I got sober in California, I did want to look into behavioral health. Well, it was called, it wasn't called behavioral health, but it was a human service kind of 2-year program.
Okay.
And so I took some classes just to get back in the swing at college. I don't know about most people, but when you first get sober, it's a little hard to get your sea legs, you know. At least I was a little uncertain and shaky, and the world around me seemed unfamiliar. So I gradually went back to taking a couple of classes. I did okay, and after a couple of years in California, I decided let's take the plunge and try and get back into the university where I was going in Iowa, and they accepted me partially due to my background, because my grades were terrible. They were a train wreck when I left. But my explanation for why they were bad and why I wanted to come back to school, I think, was convincing enough to let them give me a try. Then I was on every kind of probation they had for about 6 months.
Yeah.
And that's when I got into the social work program, eventually got my bachelor's degree in social work. And went on
So
from there.
was your experience, was that, so I'm in the human services program at Northwood Tech, and that's, for me, it's like I can relate to what we're talking about. Like, it's real world stuff. A lot of it I've been through. Did you find yourself kind of like, I don't know, were you drawn to that field because of your experience, or was it?
I think I wanted to better understand what had happened to me. This was back in the early 1990s. So at the time, I didn't think there was a very good understanding of what addiction was or how it worked. There was this, and I'm not knocking it, but there was a 12-step philosophy that was used in treatment programs at the time.
Yep.
That was sort of the guiding principle. So there wasn't a lot of other ideas or ways of talking about it. And I wanted to understand human behavior better and how and why people behaved the way they did. So it wasn't so much to fix myself so much as it was a curiosity around why did this happen to me and why does it happen to so many people. I didn't understand it. And that was what led me to take those kinds of courses initially. I had friends, I should say, that cautioned me. They said, everybody in recovery wants to be a counselor. That's what they told me. And I said, it's not that so much. It's just I want to better understand human behavior and why this particular disease acts like it does.
So fast forward a little bit, you ended up graduating as
I got my bachelor's degree. I worked
worker.
in the treatment center, sort of by chance, but I got a job in a treatment center as an adolescent counselor. And I also worked at a homeless shelter for 3 or 4 years.
Interesting.
I enjoyed that work. It was hard, but I enjoyed it.
Yeah. And then you ended up kind of taking a different route when you got your master's.
Well, before I got my master's, actually, I worked for that nonprofit for about 12 years, and I sort of moved into supervisory and director kinds of positions within that nonprofit. So I worked around in different places of Iowa. This is why we're here. But I worked in some different capacities in that job, and then I went to Hawaii, actually, on a sort of a, sorry, I'm listening to the hallway conversation.
So you worked a little bit in Minnesota, and then you made your way over here to St. Croix County.
Yeah, my first job out of grad school was the director of the Ramsey County Detoxification Center.
That's where you met Dr. Friends?
That's where I met Dr.
Okay,
Friends,
cool.
yeah. And I was there for about 3.5 years, but the transformation we made of that facility is one of the things I'm most proud of. I'm not taking credit for all of it, but we did change the culture in that facility. We did change the way the community viewed addiction, and we changed the way I hope that a lot of the other healthcare hospitals and mental health care viewed addiction. And the work that we did in that withdrawal management center was a 50-bed facility. So we got people with everything wrong that came in the doors from all over the metro area. And the way that we changed our philosophy, if I could just real quick, it had been a very punitive, almost detention center-like, a business or service. So when people came in, they were usually drug in by the police. They were frisked. They were all their stuff was taken from them. They were put in pajamas and they were sent to a common area or a room, and it was very much like a jail for intoxicated people. And when my first day of work, just to point that out, my first day of work, there was a brand new restraint chair sitting there, and the nurse manager at the time was very proud of the fact that we had a brand new restraint chair. And to me, that was a sign that things weren't going like
well.
They should be. Lots of fights, lots of staff-client violence, and we were able to transform that over time. We were able to transform that to more of a healthcare facility, where the staff and the community saw it as an opportunity for people to get help, like an urgent care for behavioral health. And we had nurses and counselors and peers. We brought peers in as volunteers because it wasn't a paid position then.
Right.
But we had peers, we had mental health counselors, and we started to make a change in that community. And we served Dakota and Washington counties and Anoka County as well. But we started to make a difference. And then the state caught wind of that and moved in the direction of withdrawal management reform. So again, I don't take credit for all of that, but it was a spark, I think, that caught fire, and we changed the way that people with addiction were treated when they came to places like this, and how they were viewed in terms of their health as a condition that they had as a result of their mental health and addiction. And I'm proud of the work that we did there. And Dr. Friends was very helpful in his consultations and his advice and his knowledge. So
it's awesome. I have been, well, I want to say lucky, but lucky enough to not have to ever go there. But I mean, I've been to detox. Well,
that's part of the problem, though. Is that vision of what that involves. And it shouldn't be a frightening thing, you know. It should be something that's seen as helpful, something that you would want to do if you needed the help.
Right.
And that's what we tried to change, was that perception, because you do get a vision in your head of what those places look like in your mind.
Right.
And they shouldn't look negatively in your mind.
In my use, it was either I was going to go to jail or I was going to wake up in a detox somewhere. Like there was no in between for me. So, I think it's great that we have those resources. And I feel like people are more open to the idea, or like going to the hospital, or, dealing with it. Like there's not so much stigma, I guess.
I think so. I think it's improving. Yeah, I think so.
If only we had one around here that people could go to.
Yeah, well, Dr. Friends is...
That's right. Yeah, there is.
Our friend Dr. Friends is trying.
Yeah. So you kind of mentioned bringing peers into Ramsey County, and obviously you've been a huge advocate for peer support here.
Oh, yeah.
What do you see as the benefit of peer support, and why are you such a big advocate?
Yeah, so peer support fills a gap in care that I think's been missing for a long time, and I think where that gap was created was when the effort was made to professionalize addiction care, insurance companies would only pay for people with professional credentials, either degrees or certifications or licenses in addiction. And there wasn't a space made for people with lived experience other than to be counselors or in that capacity, but a role for people with lived experience to walk side by side with someone who's going through that and take the time to listen to them and offer them support in ways that weren't necessarily, weren't trying to tell them what to do,
Right.
but to support them. And so I think that piece of addiction care was missing by virtue of how it evolved. So when we started to recognize that people with lived experience and some training in how to work with people with addictions could be included in the mix, I think it was a eye-opening experience for a lot of providers who saw the benefits in that. And we were one of the early ones to recognize the benefits of that in that detox center, because when we brought peers in, it calmed the whole facility down, the clients, the staff, everybody, because it gave the clients someone to talk to openly about their experiences and what they were going through. And I think too often in healthcare, we rush people through, we ask them a lot of questions, and they go to somebody else and they ask them the same questions, and they get jaded to it. And I think having peers, someone that you could develop a relationship with, maybe long-term even, that would support you through all of this and listen to you, I think that was the missing link. And then when I went to Hennepin County after Ramsey County, I also did some work with an association in Minnesota, but representing addiction providers. But when I went to Hennepin County, by that time, the state statutes had evolved to the point where peer support was a Medicaid benefit, and we were able to include peers in the Hennepin County detox center, but also then to develop a behavioral health urgent care in Hennepin County where peers were a natural part of that. I think people are starting to recognize the benefits now, or have in the last few years, of peer support. Once they understand it better, they have a better, it clicks in their head that, yes, this makes sense. And it's not just with addiction, but this was an area that I was familiar with where we included peers in the professional staff mix.
Yeah, I mean, I didn't know what it was up until a couple of years ago, and I started doing it, and obviously I see the benefit of it. But the peer support is just one of the things that you've been really supportive of in the county. I mean, you've spearheaded a few really exciting things like the recovery cafes, the harm reduction. Are we allowed to say that anymore? Risk reduction vending machine.
We are here.
What else am I missing? I feel like it's been kind of an exciting last couple of years.
Yeah, well, we have the co-responders now that go out with law enforcement. Some of those things were made possible, though, by funding through the American Rescue Plan Act. So without that funding, we probably wouldn't have been able to do these things.
Yeah.
But now that we have done them and the community's seen the positive impact, we're able to sustain them with, other funding. So
it's pretty exciting just to see the shift in the community, and how the co-responders, I mean, that's a perfect example, going out and kind of being able to work with people in a different capacity than maybe they would have before. Where it was just...
Well, and I really believe too, Kyle, that for a long time, Human Services has avoided the criminal justice involved population. We have always worked with them, but sort of kept our worlds separate. And I think that's a mistake. And I think the more we can partner with law enforcement, educate each other, and the jail and jail staff, I think that's where a lot of the, like you said, it was jail or detox. And that's where a lot of people end up being. And if we can have a more positive impact on their lives when they're arrested or encounter law enforcement, then we have a better chance of, helping people get into recovery like you are, like I am.
Yeah. Yeah, I think it's great to have more tools, for people to use. So, So what would you say is the biggest barrier, if you had to narrow it down to one, for people in our community?
To getting help for, I think it's, I still think it's stigma.
Yeah.
I do. I think especially in rural populations, I think there's still a hesitancy to reach out for help for things like addiction and mental health. It's kind of part of the addiction, or not addiction, but drinking at least, is still part of that culture.
Yeah.
And it's normalized.
It's a hard one to break,
So
for sure.
I think here anyway, that would still be my top one. And then after that, access to care. But
Yeah. Yeah, the alcohol's, I mean, it's almost glamorized, you know?
Yeah, and it was where I grew up too.
Yeah.
It was normalized. Yeah.
So, what would you say is the biggest strength for St. Croix County right now?
Oh, it's the workforce.
Yeah.
It's people like you. It's our managers and our counselors, our whole staff. Really, I mean that. I think they're genuinely interested, devoted to helping, and doing it in a way that's based in science, research. So we're not just doing what feels good to us, but we're trying to do things that align with current research, and that's important to me. So I think we want to make decisions based on data, based on actual research that's been done and peer-reviewed, and so we have a guidepost for where we're going. Otherwise, and also just around quickly, trying to move things a little upstream of where they have been historically. In other words, trying to intervene earlier in illness so that we can prevent it from becoming more severe, which is part of the harm reduction and really peer support and everything else that we're trying to do. So moving upstream of the more severe kinds of illness rather than reacting to it. That's part of our strength, I think, is that kind of vision for change that way.
I kind of wanted to see, or if you have any words of wisdom for somebody who's maybe thinking about entering the workforce, or, maybe, let's start there. And then I have a follow-up question.
Just in general for...
just helping people, yeah.
Well, I think do it for the right reasons. I think, like I was talking about earlier, certainly you don't want to go into this kind of work to fix yourself.
Right.
You want to do it for the right reasons. And the other thing I would say to anyone considering entering this field or moving it to some area of it is to just ensure that you make the effort to balance your life. And remember that, I want to beat down the door when I go into work hard, and beat down the door when you leave, right? So you want to have that balance where you're not consumed by the work you do, or it's not interfering with you to the point where it becomes out of balance that way. I think that's for every part of life.
The burnout, you carry those things home. It's really easy to let that happen.
You do have to have a degree of separation from the work you do, or it can interfere with your own mental health. So, and just to that point though, real quick, we have to be mindful of the fact that we also have mental health and physical health needs that don't make it. The work doesn't make us immune from that. So we have to take care of ourselves if we're going to help others. Yeah.
Good stuff. And then also, what would you maybe say to someone who's struggling, who might be kind of on the fence about getting help?
It's really, I know it's really difficult to first recognize that you might need help. That's one challenge in and itself, and that's the paradox of addiction, where the more damage it does, almost the more you want to hide it, or not recognize it for what it is. So if you're in that place where you're struggling with, okay, I'm aware that things are going badly. I'm aware I probably drink too much or use a drug too much. if you're questioning that at all, I would say it's easy to go to an AA meeting, an NA meeting, and not say anything and just listen, or it's easy to call someone like Kyle and just talk, doesn't commit you to anything, and explore that a little bit. And, you know, the mistake we make sometimes is that if you have an issue like addiction, that it can be fixed in a period of time, like 28 days, or if I do this, I'll be fine. It's sort of managing the disease over time. So you can expect periods of doing really well, followed by periods of not doing so well, like any chronic disease. So just try to temper your own expectations. Try to let go of some of the fear about even acknowledging that maybe you have concerns, and let somebody else just talk to you without pressuring, without trying to convince you that you have a problem, right? That's what peer support is. That's why peer support in one aspect is so important, because there isn't that pressure to, you have to tell me that you have a problem or I can't help you.
Right.
That doesn't exist. It's, let's talk about it and walk through this together. And I'm oversimplifying what you do, but there's that relationship that helps. And so it's a long-winded answer, because I get long-winded, but essentially, if you're wondering if it's causing you a problem, it probably is, and it's better to try as hard as you can to get out in front of that, so that you're not like I was, where your choices are between death and not dying.
Right.
You don't want to end up there, and you don't have to. You don't have to hit bottom. You don't have to, all those old sayings.
Yeah.
It's just really recognizing that a disease is something that sometimes you don't have control over, but there are ways to treat it and get healthy again. So I don't know if that's a very good answer, but
it's a great answer.
Difficult answer.
Yeah, and there's not ever a good answer,
No.
but I think it's helpful. Reach out and talk to somebody.
To anybody that you think would be supportive,
Helpful.
I should say.
Yeah.
Or non-judgmental.
Yeah, right. Yeah. You don't want to talk to the wrong person who could make it worse, right?
It could. Yeah.
Well, Bob, I appreciate you sharing all of that, and this has been great. I mean, just it's nice to learn from you, and
Well, same.
and I am I'm grateful that you were willing to meet with me, because, like I said, I was a little nervous, and it's I guess I'll give you kind of the last opportunity if there's anything else you want to share before we close it out.
I appreciate this opportunity. Like I told you, Kyle, I typically don't have these opportunities to talk about myself or my own experiences. Yeah. And the reason I do it is I hope, by being somewhat open about my own struggle with addiction, that maybe someone will see that, okay, he went through this and managed to, over time, come away from it, healthier. I can, I won't go into any more because you're trying to wrap up here, but I think I would say I understand if you can't imagine what's on the other